Good morning and welcome to the webinar. My name is Beth Davisson and I'm a broker advisor at Cornerstone. Today I'm joined by representatives from Anthem, Ohio for our fourth quarter carrier update series. But first we have a little bit of housekeeping. If you have any questions throughout the presentation, please type them in the question box and we will address them during the Q&A at the end. My information is on the screen if you would like to get in contact with me. And don't forget to follow us on social media and subscribe to our weekly Monday Minute newsletter. We keep you in the know with any industry and Cornerstone updates and information. Contact your Cornerstone broker advisor if you are not currently subscribed. In an effort to make our content more exclusive to Cornerstone brokers, we have locked down our resource center, including our webinar recordings, and our news page so that it now requires a username and password. But don't worry, it's very quick and easy to register. Visit www.crnstone.com to get started. Please note you must be a contracted Cornerstone broker in order to gain access to the resource center and news page. The new and improved AGB broker portal is now available for all our broker partners as your one-stop shop for managing your book of business through Cornerstone, from carrier and client information to commission schedule. If you have any questions about the new platform and your access, please reach out to your broker advisor or the AGB support team. And now I'll turn it over to Kathy Shiplett to start our fourth quarter update.
Okay, thanks, Beth. I'm going to start sharing my screen, so please let me know if you are able. Okay.
Yep.
Well, are we all set?
Yep, all good.
Okay, thanks. Thank you, everybody, for joining us this morning. My name is Kathy Shiplett. I am the Sales Account Executive working with Cornerstone in Southern Ohio. We also have with us today that will be presenting Robin Kalp, who is Account Manager, Southern Ohio as well, and Chelsea Winkler, who is our Anthem Connect specialty rep, representing the South and part of Central Ohio as well. So today we're going to be covering a lot of information, and to let you know, excuse me, I'm having allergy voice today, so I apologize for that. We'll power through. We will be sharing a copy of the presentation with Cornerstone. They can get it out to everyone. The presentation is also going to include an appendix that has a lot of additional data for you to review, to have as a resource and read through more detailed information on some of the items that we'll be covering. So first up is Robin Kalp, and she's going to be taking us through the first part of our presentation.
Good morning, everyone. We're going to start with small business trends named Anthem Best for Integrated Care. And this is the quote: Anthem has one of the most extensive networks in the country, so finding a doctor is a cinch because Anthem takes an integrated approach to medical care through combined health plans. Patient data is collected and more effectively managed care. So we are proud that we've been named Best Carrier for Integrated Care by Small Trends. So there are a few brands more widely recognized than Blue Cross Blue Shield, and no carrier can match what we offer members in the terms of network scale and density. We give members peace of mind with our national scale and our local base of providers. And this is just some statistics that prove that. So who you work with matters. We believe as a healthcare company that we should take a role more seriously and work to improve the communities that we serve, not just the members that we serve. And here just shows the Ohio impact, our community programs, and also our Anthem Foundation focus areas. Just to name, we contributed $352,000 in community sponsorships in Ohio. We've been named as one of the 50 most community-minded companies in America with our community programs. And then our focus Anthem Foundation areas, especially since the pandemic, have been maternal health, food as medicine, and substance abuse disorders. And you can see the investments there in the communities that we serve. So we're going to start and talk about our digital innovation. And Anthem's approach and investment in the digital is definitely a game changer for us. And with all the discussions with digital and AI, you know, it gets very complex, but we have simplified this through our member app, which is Sydney Health. It is the front door to everything that a member needs for their healthcare journey. And members do love the app. It's been rated 4.7 stars on the App Store and has received multiple awards here that are listed. And we mention these rewards not necessarily to brag, but to give you the confidence that your clients have an elevated experience with their Sydney Health app. So Sydney provides a true single point of access all under one roof. It integrates their benefit hub, which has medical, specialty, pharmacy, and their spending accounts. The Sydney artificial intelligence gives you chat, quick tips, and actually engages you on how to navigate the benefits in the system. And then tools for understanding drug costs and options are also included on the Sydney app. And it gives easy pharmacy refills with real-time order and shipping status. So again, one place for all your care on the Sydney Health app. Now we're going to talk about broker tools. So basically how we can help you. There are three main tools: the Producer Toolbox, Broker Plus mobile app, and then the Broker Hub. In the Producer Toolbox, that's where that's probably what you use most often. You look at your renewals, your commissions, the group information. It has forms, quoting, other tools and resources, your commissions, everything's located there. The Broker Plus mobile app is actually your Producer Toolbox on the go. And then the Broker Hub is a one-stop shop for the resources of all of our states, and it is searchable. So if you could go back one place, Kathy, to the Broker Plus. One more. There we go. The Broker Plus Toolbox. Nope, there. On the go. It's the easiest way to stay up to date on the broker news. You can check your commissions by your phone too. Basically anything you do on the Producer Toolbox, you can do on the Broker Plus. And it also has a guest feature where you don't have to do a full login, but you can still see the news. And then if you are not currently on the Broker Plus app on your phone, you can use the QR code on the screen that will actually allow you to download that capability. And then the Broker Hub, we launched this last summer, and this is basically everything you need to sell, a one-shop place for all your resources, and that would be anything selling small group as well as individual and large group. So again, all searchable, it's filterable, it has all of our 14 states. So if you sell in multiple states like Kentucky, Indiana, and Ohio, you can get all of those the pieces of information that are specific to each state on the Resource Center, the Broker Hub. So one place to get everything. The best feature or the thing that I like the most is you can actually pull up the information or the document and you can send it instantly to another member of your team if you're working on something together, or the client themselves. So again, just a great resource for everything Anthem. Coming soon, APIs, which is the application program interface. And we have piloted a program with Ease and Employee Navigator, and this should roll out in 2023. And basically what it does, it's a seamless real-time integration with the platforms that you use today with your clients. And it's just adds a simplified experience. And since the platforms will talk to each other, the information, it does not have to be entered multiple times, which also will reduce the errors that are done. and we will give you additional information on this as soon as the exact time is given to us, but it should be sometime in 2023. So now employer tools. So employer access obviously is our biggest employer tool, and it is the one-stop online benefit management, which includes the bill pay. So that is our employer access. Coming in 2023, we are going to have an employee resource center, and that should improve the dynamic dashboard as well as an expanded resources, including integrated materials and videos for both employees and employers. And then our benefit guide blog, it will offer informative, easy to read posts on healthcare news, trends, and legislative information. So those are all things coming in 2023. So again, employer access, I'm sure all of you use this a lot. It is, again, our benefit management system. So enrollment, you can add, terminate, fix CPCP information, that sort of thing. Also, billing and payments can be done via employer access for our ACA groups. Member management has details, information, ID cards. You can subscribers, you can edit subscriber information. So all of those functions. And then administratively, you can view all your employer details, the benefits, and any administration that you are doing. It, also has access to all like the 1094s, 95s, things like that that are done with the SACME as well. So with that, I believe Kathy's going to go over our medical products.
Thanks, Robin. Okay, let's dig into our medical products and what is changing for 2023. So first, we have some product updates that apply across all of our platforms, namely LiveHealth Online. The primary care and behavioral health visits through LiveHealth Online are going to have no copay in 2023 on copay-based plans. Obviously, with the HSA plans, there is still going to be a cost associated with it, but copay-based plans, there's no copay for LiveHealth Online. Our emotional well-being resources are just being shifted to be under our foundational programs. We'll talk more about this later. And we're also adding LARC diabetes prevention program to all of our platforms in 2023. This again, we'll talk a little bit more about later. Kidney transplants currently are covered under our standard medical benefits, but we are moving those to be covered under human organ and tissue transplant benefits. So with the LiveHealth Online, by removing the copay, we are simplifying the virtual care experience for members by improving access to pediatric virtual visits as well as mental health and substance abuse services for all ages. This is an outline, kind of a screenshot of what a SOB looks like, and you'll see that there's two different places for virtual visits listed on here. We work with two different partners for virtual care. On the Sydney app, we work with K-Health to offer medical chats and virtual visits, and this is at no copay. K-Health provides care for adults only through these options. So LiveHealth Online will include the virtual visits for pediatrics, mental health, and substance abuse. And by moving that to a no copay as well, we're enhancing and simplifying the members' access to virtual care. Now let's look individually at our different portfolios and platforms and what's going on with each of these. First up is our Anthem Link plans. The Link plans are available on both ACA and SACA benefit plan platforms. This is an HMO product that is built around a high performance network. So let's take a look at what the Link plan is. The Anthem Link plans offer cost savings and a high performing provider network. With its digital first design, Anthem Link plans improve access to preventive care, leading to a healthier workforce, leverages an all-in-one solution with virtual platform, networks, a scheduler, and customer service, provides robust health support through both virtual and in-person care. It provides virtual primary care at no cost on the copay plans, and it empowers employees to seek virtual care for health issues ASAP. And it improves engagement in the members' existing care and tools available. We have a couple of specific changes that are coming up with Link plans in 2023. First, the PCP copays for office visits for children under the age of 19, there's going to be no copay for PCP visits for children under the age of 19. And the second is that we are expanding the network to include Dayton this year. So in Dayton, our network providers are going to be Premier Health and Dayton Children's. So as you will see in the top right of the screen, there is a cost of care savings of 15% versus a comparable PPO plan. This is huge savings to be able to offer to a group, especially built around such a strong network as Premier and Dayton Children's. So the Anthem Link plans will be available in Dayton beginning January 1 for your January business. The other locations that we are covering with the Link plans in Ohio include Columbus. This network is built around Ohio Health and Nationwide Children's. In Columbus, we are seeing about an 8.5% savings over a comparable PPO. And the third location that we have the Link plans available is in Cincinnati. And this network is built around Tri-Health and Cincinnati Children's. In Cincinnati, we're seeing about a 10% cost of care savings over a comparable PPO plan. And please note that you can always offer an Anthem Link plan as part of a dual or a triple option for your groups, so that they can still offer their employees the choice if they're concerned about offering a limited network. You can offer 2 plans to a group of 3 or more, and you can offer 3 plans to a group of 10 or more enrolling. So please keep this in mind. There's huge savings available to these groups, and we want to make sure that you're aware of some of the different options and plan designs that we have created to make healthcare more affordable. Next, we want to talk about the SACA benefit plan platform. As you are probably aware, the SACA benefit plan offers the groups the opportunity to qualify for better rates through medical underwriting. It also offers the stability of being part of a large pool with Anthem's breadth of experience in the small group market. We also have the clinical integration with Anthem's Whole Health Connection, providing whole person care for employees with integrated medical, dental, vision, life, and disability plans. With our SACA benefit plans, the platform offers Anthem's Broad Blue Access PPO network, and we also offer the Anthem Link HMO network. Changes that are coming up this year, we do have a total of 32 plans that we are offering. 27 of those are PPO and HSA plans, and we offer 5 Link HMO plans as well. We are adding 1 new plan this year. It is a $6,700 embedded deductible plan. This is an HSA, and it includes a preventive RX, which I'm going to explain here in a moment. We are not discontinuing double negative. No current plans are being discontinued in 2023. There are some cost shares that have been adjusted so that we can keep rates competitive, or in some cases keep in line with the CMS guidelines. Our RX Choice tiered network tiering, this is the pharmacy network. There will be changes with that in 2023, so we will be talking more about that as well. So I mentioned the new Preventive RX Plus plans, and we have two plans that we're going to be offering this year. One is on the SACA BP platform, and the other is on the Ohio Farm Bureau platform. The new Preventive RX plans were designed so that members with chronic conditions that are listed here on the slide and require maintenance meds, they're able to have a copay instead of the cost of those meds going towards the deductible. It is a specific list of medications, and the list is available on our website. The members will be able to either pay a tier 1 or a tier 2 copay. Those copays will go towards their out-of-pocket, but does not accumulate towards the deductible. Next, let's look at our Ohio Farm Bureau plans. The Ohio Farm Bureau is a MIWA that's available for all of our brokers to sell. It's set up very similarly to our SACA MIWA, meaning that it's underwritten the same way, using the same rating factors. So there's no need to request separate pre-screens if you are not sure which way to go for your group. I do want to point out some of the differences between the two. There is a specific list of SIC codes for the Farm Bureau plan, so they do have to fall within the realm of the Farm Bureau. However, this is much more comprehensive than what you would expect if you consider all of the businesses that are involved, from getting the food from the farm to the table. We do have a list of these SIC codes available, and I do want to mention that if you have a group that feels like it should be able to be a part of this and it's not on the list, please have your broker representative reach out to us. This is something that we can work with, and we have added several SIC codes upon request to the list. We just have to get approval from the Farm Bureau. So if it's not currently on the list, but it makes sense, we've had a food bank recently added. We've had maintenance equipment companies added. So don't let the list limit you, but it will give you a guideline of what is acceptable. Membership is required for the Farm Bureau as opposed to being a part of a chamber for the SACA BP. The Farm Bureau does allow a group of 1 without the requirement of being a sole prop, which is a requirement for the SACA BP, but with the Farm Bureau, they do allow groups of 1. And they also offer some different plan designs. You might see some richer plan designs available through the Farm Bureau than what we would have in the SACA BP. So if you have a group that would be eligible for Farm Bureau and you're not sure which would be the best fit, please reach out to your benefit advisors, and we are also here to help in trying to determine which will be the best fit for the groups. So with the Farm Bureau, there are 15 total plans, and we're offering 2 new plans, both of them HSA. One is a $3,000 embedded deductible, and the other is a $6,550 embedded deductible that includes the Preventive RX. No current plans are being discontinued. The membership for the Farm Bureau is $750 PEPM, and this is going into effect January 1 for new and renewing business. Currently, that membership is at $6 PEPM. With the Farm Bureau, everybody has a common renewal of 1/1. So new and renewing business January 1, this will be the new dues that will apply. Some of the cost shares, again, have been adjusted as needed. One of the big additions we are adding here is the addition of the Engagement Package 200 Wellbeing Incentives to the Farm Bureau. This is something that we added to our SACA BP plans for 2022, gives member incentives. It's been very popular. We're able to extend that to now cover the Farm Bureau plans as well. And again, RX Choice tiered network is utilized for the Farm Bureau, so those tiering changes will apply here as well. With the ACA plans, let's talk about what's going on with our ACA plans in 2023. As you're aware, ACA plans are the community rated plans that can be given to your groups without medical questions. We have a total of 41 plans for ACA. There's a lot. We have 28 PPO and HSA style plans. We offer 6 of the Link HMO plans, which we discussed earlier, and 7 Pathway HMO plans. The reason that we offer 2 different HMOs is that you may remember that there's only 3 areas that we cover with the Link plans, those being Dayton, Cincinnati, and Columbus. The Pathway HMO covers all of Ohio. Regardless of where your group is located, they would have the Pathway HMO available to them. We do have some plans that we are discontinuing, and the mapping information will be included in the appendix, so you can see where we are mapping the groups that are currently on these plans. Cost shares have been adjusted where needed, and again, the tiering for the pharmacies is going to be changing. A couple of changes going on with our ACA plans. First, currently we have Plus plans. These offer fitness reimbursement for gym memberships up to $400 annually, but we have not seen a lot of engagement with that program, so we've decided to do away with the gym reimbursement. We are continuing. Another piece of those Plus plans is that we were offering the engagement 200 incentives. That part of it will continue. It's just the reimbursement piece for the gym membership that we are discontinuing. Several plans on the lower end of the gold and silver platforms are going to be richer this year because CMS narrowed the actuarial value ranges. So you're going to see some of those lower end plans have a little bit richer benefits so that we could keep within those AV ranges. And then on ACA plans only, the 4th tier for the RX copays are going up by $25. So depending on which level pharmacy you are utilizing, it's either going to be increasing to $350 or $450, a $25 increase. Wellbeing Perks plans. This is a plan design that we offer on some ACA plans, not all of them, but these are specific plans. And this offers incentives for members to complete wellness activities, and it also provides premium credits to the groups based upon their member engagement. So employees and spouses or their domestic partner are eligible for the rewards that are listed here on the slide. They can earn gift cards by completing a health assessment and certifying that they are tobacco free, by having their annual wellness exam and getting their annual flu shot, and also by receiving a dental exam. Part of the Wellbeing Perks plans is that it includes dental and vision. So there are dental and vision benefits included on the Wellbeing Perks plans that are not separate. They are part of this program. So based upon the employee engagement, the employer can receive an incentive, and this is based upon the premium paid in the full calendar year, and the credit is given in the following plan year. So the group does have to renew in order to receive these premium credits, but they can earn anywhere from 2.5% up to 10% of their previous year's premium credit based upon their employees' engagement. And we do have reporting that will be available to them on the employer access site so that they can kind of view what's going on and manage and monitor the engagement of the employees. If you have groups that are in ACA, you're looking at the ACA plans for them, I see no reason why you should not be giving them the Wellbeing Perks plans. The rates are very competitive. It includes the the dental and vision, they do not have to buy separately, or if they don't feel they have the extra money, it's included in the price of this plan. And the members can earn gift cards as well as them earning premium credits. So anybody that you have in ACA, please make sure that you are taking a look at these plans. Next up, our grandmothered plans. No surprise to anyone, transitional relief is being continued. So we're continuing to offer our grandmothered plans. We are offering 4 new step-down plans because these groups have stuck with this for a really long time, and a lot of them were noticing that they are bottoming out on their benefits when they're trying to find cost savings year after year. So we've added 4 new plans for them to have alternatives to offer a cost savings. Also this year, we are going to be developing ACA renewal options for all of our grandmother groups. These will be available to you as the broker, but will not be mailed to the group. So this is given to you for your information, comparison purposes of where they are versus where the rates are for ACA, but they are not being shared with the group. We're leaving that up to you as the broker if you feel that that would be a beneficial conversation. So the plans that we're offering, the step-down plans for grandmothered groups, we have 4 plans that we're adding: 2 PPO, 2 HSA, deductibles from $6,000 to $8,000. And due to the changes in the IRS guidelines, we're no longer able to offer $2,800 embedded HSA plans. So those are all going to be mapped over to $3,000 deductible HSA plans. Next, I want to kind of talk about our well-being products. Our well-being solutions programs, they focus on the health and wellness in 3 different key ways. One is the awareness and prevention for healthier living. Next is resources and care guidance for better outcomes and cost savings, and also offering a simplified experience that promotes engagement to our members. With Wellbeing Solutions, your clients get nearly 20 core integrated components that create healthier, more productive workforce. These include our Sydney Health app, which is a fully integrated digital experience. Sydney can do everything from send reminders about care and preventive checkups and tests, provides information on how to find a doctor using quality and cost information. And it also can provide health tips based upon the member's medical history. Our condition care programs are offered for those with chronic conditions, such as asthma and diabetes. It's a one-on-one professional to help manage health and reach a member's health goals. We still have our 24/7 nurse line. We've had this has gone back way before the digital applications have started, but this is registered nurses that are available anytime to advise on health issues and help find care that the members may need. Our Future Moms program, it offers nurses that can help the members who are pregnant to follow a plan of care, identify risks, make healthier decisions, and prepare for the delivery. And we offer a very robust cancer care quality program as well, and autism spectrum disorder with applied behavioral analysis, just to name a few of the programs that are included in the Wellbeing Solutions. This slide shows all of the programs that are part of this foundational program, and this applies to our small groups across the board. Now, building upon that foundational Wellbeing Solutions package, we offer the Engagement Package 200. And this is included in 5 of our ACA plans, as well as all of our SACA benefit plans and Ohio Farm Bureau plans. So this has included all of the SACA benefit plans, Ohio Farm Bureau, and select ACA plans. With this, the subscriber and spouse or domestic partner can earn up to $200 per year by completing activities in 4 different categories. The incentives can be claims-based, preventive care, wellness, condition management, and personalization. So there's a long list of ways that the members can engage with their health. With the claims-based section, I want to point out that there is nothing for the members to do in order to receive the rewards that are attached to the preventive that are claim-based here. Once the claim is received and processed, that will trigger the dollar value to be put into the member's account. So there's nothing that the member needs to do on the claim-based services. Next, I want to talk about the new diabetes prevention program that I had mentioned earlier. This was created to proactively engage pre-diabetics to make small changes that can reduce their risk in progressing to type 2 diabetes. In the last 5 years, diabetes has more than doubled in size to cover more than 10% of the US population. And diabetics overall have a 2.3 times higher annual medical costs. And pre-diabetes is even more prevalent. It's likely that 1 in 3 members has pre-diabetes, but it's a hidden problem because the majority of people do not know that they are pre-diabetic. The diabetes prevention programs are recognized by the CDC, and they are considered an ACA preventive care benefit. And therefore, these are paid at 100% when provided in network. The LARC program is an online digital program that focuses on cutting the risk of developing type 2 diabetes through healthy eating and physical activity. The program is specifically for members that are pre-diabetic, and they can determine if they are eligible by taking a risk assessment. Once in the program has 4 different milestones for members. The first one is just strictly enrollment. The next is engagement in 2 of the first 4 weeks. The next is 2 weeks of engagement during weeks 5 through 9. And the last being a goal of 5% weight loss within 1 year. Next, let's talk about virtual care. Anthem has game-changing access to comprehensive, unlimited primary care. We offer it to our members through their Sydney Health app. Virtual primary care doctors can help close primary care gaps by providing wellness checks, management of chronic conditions, and depending on the plan design, this would be at a low or a no cost to members. Members have access to a virtual care team that includes preventive care and wellness checks, care plans for overall health and chronic conditions, prescription management, and referrals to in-network providers. And through AI, the symptom checker tool narrows down millions of medical data points to give relevant guidance to the next steps and enable providers to focus on what matters, and that's delivering quality, affordable care more efficiently. Virtual primary care offers game-changing coverage and protection employees can trust in every moment of health. It's all part of our integrated whole person approach to healthcare. With our virtual primary care, we offer full service wellness visits, behavioral health, video-based psychology and psychiatry. Wellness visits can be done in text chat, and they are considered preventive. So the member is eligible for an incentive credit by doing a wellness visit through text. Prescriptions can be prescribed and refilled. And with the virtual primary care, the member selects a practice group. It's a team approach. So the member may or may not see the same provider from visit to visit, but they are all in the loop regarding the member's care. Next up, I want to talk about behavioral health and the confidence of compassion. Access to mental health treatment and support is a challenge, which often leads to higher cost. Significant shortages in mental health providers means it's harder to find a doctor. And patients that use out-of-network providers for substantially higher proportion for behavioral health care than they do for any medical or surgical care. Even when there are mental health providers, the waiting times can be very long. So as a result of these barriers to care and an increasing prevalence in mental care and mental health and substance abuse disorders, the rate of ER visits for mental and substance abuse issues has increased by 44%. And when we look at the big three on the slide, you can get an idea of what makes us different. 4 out of 5 people are living in Anthem markets with access to a behavioral health specialist within 20 minutes of where they live or work. Behavioral health case management can save participants over $3,000 a year and reduces on average the total inpatient medical spend by 21%. We also offer the virtual video appointments in 7 days or less, and this is about half the time it takes for an average in-person appointment. Our behavioral health program helps employees to live their best lives with virtual psychology, virtual visits through LiveHealth Online with a psychiatrist, psychologist, or a licensed therapist. We also have a 24/7 call center that allows members to connect with behavioral health staff and clinicians via phone or chat to support crisis management, help connecting to appropriate resources and providers, and assistance in understanding behavioral health. Behavioral health case management is embedded with all of our plans, individual, small group, and large group. And the care is coordinated between the medical management and behavioral health teams and includes proactive engagement to specialty programs. Next, let's talk about pharmacy. Anthem's own PBM manages every aspect of pharmacy with medical for better care, improved outcomes, and lower overall costs. One thing I do want to point out, our Ingenio RX will be joining the Carelon family of companies. So beginning January 2023, we are changing the name of our PBM to be Carelon RX. ZipDrug improves the member's experience by connecting them to high-quality local pharmacies that offer personalized services. This is coordinated prescription refills and scheduled hand delivery right to the member's doorstep at no additional cost. This provides pre-sorted multi-dose packaging to help manage those medications. There is a seamless transfer of prescriptions and setup of the member's personalized fulfillment plan. But I did want to point out that ZipDrug is not included on the grandmothered plan. So this is for ACA, SACA BP, and the Farm Bureau. We have enhanced capabilities on our Sydney app, such as price a medication, find a pharmacy, video chat with a pharmacist. This gives 24/7 access to dedicated pharmacy experts, including click to chat. Just some of the enhancements that we have on our Sydney app to help with pharmacy and prescription adherence. With our RX Choice with optional home delivery, consumers can choose any pharmacy that they want in the network, but they can pay a lower cost out of pocket when they choose to get their prescriptions filled from a preferred pharmacy. So we have tiers, tier 1 and tier 2 within our pharmacy network. They can also utilize the benefits of our home delivery program. There's approximately 67,000 pharmacies included in our tiered network. Tier 1 of this network, for example, some of the higher well-known chains, CVS, Walmart, and Kroger. These are all part of Tier 1. As I had mentioned, there's going to be changes in the tiering within the network of pharmacies. So there are going to be some pharmacies that are moving to level 2 that are currently listed as level 1. And this means that there's going to be a higher member cost share if they use the pharmacies that are listed in Tier 2. But please note that members that have utilized one of these pharmacies in the last 6 months will be notified via mail of the change in that pharmacy. So the members will be notified. We just want to make you aware that we are making this shift. So there are namely of the large name chains, Sam's Club and Costco are moving from Tier 1 to Tier 2. But as you can see on the slide, the Tier 2 pharmacies are increasing from 26,000 to about 40,000 pharmacies. So there are a lot of small independent pharmacies that will be moving to Tier 2 as well. Next, I just want to quickly touch on some legislative updates that are happening. Our certificate booklets are going to be edited to make sure that they include the Ohio mandates that were made effective in 2022. Namely, House Bill 371 in requiring insurers to cover additional breast imaging for women who have dense breast tissue or a family history of breast cancer. House Bill 37 requiring insurers to cover 3 emergency filled doses in a 12-month period. That's a change from just a 1 emergency refill. And House Bill 122 is codifying telehealth expansions. Certificate changes that are related to all of the above listed on this slide. There's going to be more detail surrounding this in the appendix that is attached to this presentation. So next up, I'm going to turn it over to Chelsea Winkler, who's going to take us through some specialty information. Chelsea?
Chelsea, we're having a hard time hearing you.
Chelsea, are you there? Okay, we may have lost Chelsea, so I'm going to continue to drive the bus here. Our Ohio Anthem Connect team, we have 2 different specialty reps, one Chelsea Winkler and the other is Jeff Reed, and they split the state between the 2 of them. And they are here to help with pre-sales through the sale with renewals and quoting of all of the dental, vision, life, and disability products.
Hi, Kathy. I'm here. Sorry, I was having trouble unmuting it. I don't know why it's freezing. Sorry about that.
Chelsea, I'll let you take it from here.
Yep, I'm sorry about that. It just kept freezing. It was super weird. Yes, as Kathy said, Jeff and I kind of split the state. I'm in the southern half with you guys, and we kind of help with pre-sales, through the sale, renewals, quotes, any kind of daily maintenance questions, any quotes you guys might need, have any questions matching a plan, anything like that. That's what we're here for all things specialty. So just kind of wanted to talk to you guys about the Anthem, especially Whole Health Connection. I'll be quick since I know we're already at the top of the hour, but basically talking about linking dental, vision, life, disability plans with medical for better care, better experience, and lower costs. And the thing I kind of want to just point out here out of these 3 impacts that adding specialty with medical has had is the easy to administer and easy to use, 1 enrollment, 1 billing portal, 1 ID card for all of our ACA and SACA MIWA groups. So what sets Anthem apart is that no standalone carrier can integrate with medical like Anthem, and our members kind of benefit from end-to-end, connecting all lines of care for early detection, management, and lower costs, and just again a better kind of experience using the Sydney app is also super beneficial, and they can see all of their lines of coverage right there, and alerting cares and different alerts to linking the doctors with the dentist, and to prevent any diseases at early detection. Then just kind of quick on the SACA benefit plan. We do have our one-time medical credit again for 2023 for groups that add non-voluntary dental, vision, or at least 25K in life. This is based on the number of enrolled medical subscribers. To get the one-time credit, it's applied right to the medical bill within 90 days. And again, it does have to be that non-voluntary. And just kind of as a reminder that we do not require contribution for our non-voluntary plans. We are completely participation based. So as long as that group meets the 50% for dental and vision, they can get the non-voluntary plans along with that credit. Anthem Dental, just kind of wanted to point out that we do have that 5% bundled discount with new dental coverage when it's bundled with vision, life, or disability. This is for ACA groups. We do have 137,000 dentists at 574,000 locations nationwide. And we do have that ortho at home benefit, which is extremely beneficial to members. And just kind of having this dental coverage combined with medical, kind of as you can see those numbers on there, lowers ER visits by 10% with that early detection, like I kind of talked about, the heart attacks, and inpatient admissions by 13%. And we also do have that 74% utilization with our network as well. This is just kind of specific to Ohio. We have over 4,100 unique dentists at over almost 15,000 locations just in the state. Anthem Vision in our network is the Blue View Vision Network. We have over 40,000 eye doctors at 30,000 locations. And we do have that special offers program, which it has a whole site of a ton of different discounts on various things. But we do have also, which is huge, is a huge discount on the laser vision correction surgery through that special offers program. And then these are just kind of some of the numbers as well. We do have that 97% in-network utilization, so you guys are covered everywhere. Excuse me. And this is also just specific to Ohio, over 1,700 unique eye doctors at over 1,200 locations. And again, with that 97% in-network utilization. Anthem Life Disability. We do have the 50K guarantee issue, which is what I want to point out here. And as well, if members, retire, we do have that convertibility option without going through underwriting, so they can absolutely take it with. And I just kind of wanted to point out that we do have that. And we also do have that includes our resource advisor on all Anthem L&D products. And it's kind of like a mini EAP, which includes a resource advisor, which has a ton of different benefits, as well as like our travel assistant program. Those are all completely free, and you can see everything right on the site of all the different things that it does offer. Thank you, guys.
Okay, thanks, Chelsea. Next, Robin is going to take us through some information on renewals, what everybody has been waiting for. Robin?
All right. So we're going to talk first on our MIWA renewals. These should drop the week of October the 10th. So if, much like it has been in the past, if you renew as is, just inform your Cornerstone benefit advisor so they can let us know. If there are any changes that need to be made for the medical and/or specialty, again, submit the information to your Cornerstone benefit advisor, but you will need the signed alternate rate sheet as well as the administrative and benefit change authorization form to get that change made. If you're adding a line of specialty coverage, can you also submit that to your Cornerstone benefit advisor and all of the information there that is required for that specialty change. Group terminations, again, submit that on company letterhead signed by an authorized signer to your Cornerstone benefit advisor for processing. And as always, open enrollment changes for medical and/or specialty should be done on the employer access. So our grandmothered renewals, those have already dropped, and you should be receiving those shortly. It took a long time just due to the quantity of them, but our average increase was 9%, and that included aging and demographic changes. So 71% of our renewals were actually under 10%, so single digits. You know, we're happy about that. I hope that you are as well. There's always some outliers. So any information that you can share with your benefit advisors to help us maybe be able to reduce that, just let us know. Again, the grandmothered renewals, you will receive that renewal as well as an ACA renewal alternative from Cornerstone. And the group was only going to receive the grandmothered copy. So you will need to share that ACA renewal with them if it fits, you know, if it fits for them, or at least just show them, you know, they would have received a 40% increase versus a 9 or something like that, whatever it would be for that particular group. But the renewals will be sent out to the groups the week of October the 25th. So that's about 65 days prior to their renewal date, which is typically what we, you know, set out to do. The options at renewal are the same. Keep current plan. You would just notify your broker advisor. No paperwork is necessary. If they want to move to another option, all of the grandmothered renewals will include all of the renewal alternatives, so you won't have to have anything additional ran as options. So that alternate plan will be included in the renewal. So that's why the renewals are a little bit more meaty, longer. But there is a next step renewal decision form that needs to be included with that alternate if the group has decided to make that change, and that all needs to be sent to your broker advisor, and then they will submit it to us here at Anthem. Also, if the ACA option, renewal option, is a better alternative for that group, that needs to be sent to us by 12/5 to ensure a smooth transition from one platform to the other. So again, send that information to your broker advisor and they will get that to us for processing. And then if maybe the group is interested in the SACA benefit plan, get with your broker advisor and we will ask underwriting and inform you whether that is a good fit for the MEWA or not. That way you don't waste your time completing applications if the group would not have been a good fit to start with. So we like to do as much work as we can in advance to relieve you of some of those things. And then one thing I wanted, this is just an example of what the grandmother renewal packet will look like with all of the plan alternatives. And this is the composite rated version. And the second option is the age gender rated version. And I just want to remind you that our grandmother renewals are the way they're tiered is depending on the size of the group. So age gender rated is groups from 2 to 9, and our 10 plus groups are always composite rated. So the number of enrolled drives which way they're rated. So that's not something you can choose like you can on the ACA platform. So I just wanted to make sure you realize that. That's why sometimes, you know, the groups that go back and forth between 9 and 10 sometimes have obviously a different tiering of how their rates are. So with that, I think we are done with all of our presentation. If you had any questions.
There was one question on here. They wanted to know, how do the Farm Bureau rates compare to SACA rates?
The rates are very similar. But in saying that, like I mentioned, the underwriting is all done the same. The tiering behind the scenes is different because this was brought over from another carrier previously. So, you know, we tried to make it as seamless as possible and kept the way that the tiering was done on the Ohio Farm Bureau. So you may see some changes, you know, age-wise, things like that. But to point out, that rates are higher on one versus the other, we can't exactly do that. So they are very similar to each other, and based upon the plan designs, because those are different as well. You can compare the two to see what differences there are, but it can vary group to group.
Okay, well, that was the only question. So thanks to Anthem, and thanks for attending our fourth quarter Anthem update. And everyone have a great day.
Thank you.
Thanks, everyone.
Thank you.